Good afternoon and welcome everyone to MPHA's 2017 webinar series. My name is Becca Bolus and I am the Executive Director of the Maine Public Health Association. The goal of MPHA's webinar series is to feature and promote ongoing public health work in Maine, and that includes accomplishments, current events, programs, and resources, a variety of work that is going on in our state. And that's because there really is a lot of exciting work and there's a lot to celebrate and to promote. So if you are interested in being featured in one of our future webinars, please let me know. We are grateful to the Maine Area Health Education Center and the New England Public Health Training Center for their generous support of this webinar series, which is really available to anyone who's interested in public health in Maine. Shortly, I will turn it over to Darren Ripley, who's the coordinator of the Maine Alliance for Addiction Recovery. Today, Darren will be presenting about a new resources app that MAAR developed. While the app has online capabilities, it's most useful when accessed via smartphone. So if you haven't already, I encourage you to please download the app to your phone so that Darren, as he's walking us through some of the resources, you'll be able to follow along. To download the free app, please visit the App Store on your smartphone and search for Maine Alliance for Addiction Recovery Resources app. So a few words there. Since this presentation is more interactive than most of our other webinars, if you do have questions while he's presenting, you don't need to wait until the end. There's a gray call-out box in the other gray box that you have on your screen. If you click there, you can type in your question while the presentation is going on. And I'll do my best to moderate during the webinar. If I do not get to your question, I'm sure Darren would be happy to answer any questions once he's done presenting. And the last thing I want to say is just to shorten the box, there's a gray arrow on the right-hand side. If you click that, the box will get a little bit smaller so it doesn't take up quite so much of your screen. So again, I want to thank you all very much for joining us today, and I'd like now to turn it over to Darren.
Thank you, Becca. I appreciate that. And thank you, everyone. Can everyone hear me okay? Okay.
I can.
All right, wonderful. And everyone can see my screen. You should all be looking at my at a map right now, the Maine Alliance for Addiction Recovery Community Asset Map. And hopefully everyone can see that.
Yep, we can see that.
Wonderful. So a little history on this map is back in 2 years ago, probably right around this time, SAMHSA, their brass tacks, what they call brass tacks, it's another program underneath SAMHSA, bringing recovery supports to scale technical assistance center strategy. My goodness, I got that out. They had awarded, I put in for a grant, and it was a small grant, but they awarded us the grant, and part of it was really looking at treatment facilities, what we were going to develop, so to help people that were seeking treatment. And I came up with, let's develop a community asset map that is interactive, that folks can go to, and went around, did several focus groups in the districts. They provided me information. I sent out several links. I did a Survey Monkey that would ask a lot of the questions, and they could send them back. I sent out paper copies. I have 606 entries on here, and I know there are a lot more out there. However, some did not reply. I am adding to it at all the time, and it kind of grew. It really grew from, as you can see at the bottom, what started out was just going to be kind of treatment and residential and some detoxes, and the information that I was getting was very overwhelming, and I said, well, I'm not going to stop there. I'm just going to keep on going. So there were sober living homes, the community resources, recovery support groups, And I did not list. I could not list every recovery support group. So what I basically did for that is any 12-step group, I listed the central office where people can go. Detoxification, that's a very small list. Extended care. It went to psychiatric hospital. Faith-based recovery. Medication-assisted treatment. Young people in recovery, which is YPR. Even went to food pantries. I figured, all of this would be helpful to anyone that is looking for it. And it can be. It was exciting to do. Lengthy because every one of these I had to make sure I did the research and what they put in, what they provided me. And so it was all put in by hand. So all of these were put in by me by hand. So it can be filtered out. You uncheck all. If I was looking for just emergency shelters, I would go to there, and you could look up milestone. If I were to go on, let me see. New Hope for Women. I think we'll go with Augusta because that's so the Bread of Life. So if you click on that, this is the information that I've entered in there. It tells you, it'll take you to their website. It gives you the description, their email, and this is all information that they have provided me. And I think the great thing about it is if you want to click on, and it goes right to their website. So all the URLs are in there, and once in a while people change the URLs, and I try to keep everything updated the best that I can. Being a one-man show, sometimes that's hard to do. So that can be, and then you have your treatment agencies, which has been one of the things that I did ask, of the treatment agencies. When I look at that was, what they provided for services, because a lot of people when they want to go into this, they want to know, okay, what's actually happening. So if I go to crisis and counseling, I want to know if there was a sliding fee, what the payment accepted. I asked them that, the services that they did provide. If there was anything, recovery support services, that was one of the big questions I wanted to ask, if they provided recovery support services. And this is the information that they give me back. So it is helpful for a lot of folks. I have this up and running at all times because I take so many calls from people looking for treatment. They may be looking for a medication-assisted treatment. So it's easy for me just to grab a hold of this and look and see where I want it, what I want to grab. I even put hospitals in there. Not all of them, but I've just started listing everything, kind of adding to it and enjoying what I was doing with it. So it's very interactive. You can the map, you can actually, for anyone that wants to, that is tech savvy, you can take this map and you can embed the map if you would want to. Once you go to the site, you can embed it onto your website, and that's what I did with our website, was embed the map onto there. So if you have an IT person that can do this, I've made it available that anyone can take that and embed it onto their website, or if they just want to bookmark it. Some people have bookmarked it and utilized it as that. So this is what it started out as. It started out as the community asset map in order to comply with my grant that I had to do. I'm going to stop there for a minute to see if there's any questions or... Oh my goodness.
No, there may not be. If someone does have a question, you can either unmute yourself or you can click on that call out box and we can answer your question.
Okay. So, all right, so I'll continue on. So as I was doing the map, I got thinking I wanted to build an application that was also for recovery resources, and wanted to make that available for Android-based systems and iOS systems. So one weekend, I was just sitting home, and I said, "Well, I'm going to build the app." So I created the app, the MAAR Recovery Resource app. It's MAAR Recovery Resource, and it's available in Google Play Store or on your, if you have the App Store and you're on an iOS system. And so I started developing that, and that just led to actually more. And this map is actually on there. So this came first, the app came after that I built. But and I'm not sure if everyone, I can go through that app. I'm not sure who has it, if anyone has it downloaded, if they would like me to go through that app, if they have any questions about that app, or if we could be looking at it.
I think it'd be great if you went through the app. It'd be very helpful.
Okay. So if anyone is looking at that app at this point, as it comes on, you open it up, and it tells you about the Maine Alliance for Addiction Recovery. And on the bottom, and it has our website there, and my contact. And this website is our new website, which we just launched. We had it's more interactive, so it's with a new carrier. My contact information, it has all of that in there. It has my social media, which is the Facebook, and as I went over and you look at more, you hit more, and I'm like, okay, that list is very long, and as I just continued to add to it, I continued to add to the more. So at the top of it is a survey, and this is a survey I created a few years ago to send out there. It's the Substance Use Recovery Survey, and it was to get information in different geographical areas of how things are going with people that are living in that area. Are they receiving any treatment services, and asking them what has helped make their recovery easier, some of the needs not being met. So it was information that I have been gathering, and it comes to me through any answers come to me, and I can narrow them down through SurveyMonkey. Then, as you notice, like the third one down is the find help, and that is this map that we're looking at right now. So that is on there also. You can, and that can be filtered out on your smartphone or iPad, whatever you may have. And I just kept on going. Like I put up the Portland Recovery Community Center, Young People in Recovery, Bangor Area Recovery Network, Recovery Coach. That is part of our program that I run here, and it takes you to our website and explains what a recovery coach is. It talks about that. Advocacy, the naloxone instructional video, which was done with Maine General. We did with Maine General, gosh, it has to be 3 years ago. So it's with the old atomizer, but it takes you to that. It gives a person the opportunity to go to Smart Recovery Online, AA and NA Online, the recovery support programs that it gives you. It takes you once again to Recovery Support Resources, which is on my page, and list all of the programs that are there. It lists if someone's searching for a recovery coach. I also have a list of active recovery coaches by region that they can click on. What you'll notice is the Rock, and that's University of Southern Maine's collegiate recovery program that they have started. And I trained folks back to be recovery coaches back in, oh goodness, June. I'll go with June. That's my final answer. I trained folks that were attending USM and becoming part of this program. So after they had finished and they opened that up, I went back to the app and added that in there. And so I'm always adding. Hopefully I'm not deleting anything off in the app. I've found it very helpful, and I've encouraged other definitely therapists, clinicians at agencies or private practices to most definitely use this. If anything, the map itself to utilize that. But this is just some of the stuff that I've been doing and trying to make recovery a little bit and the resources a bit easier for people to find.
Darren, there is a question. How do you update the information that's on here? There are different resources.
I depend on folks actually providing me with that information. So if there's something new that opens up, if I hear of anything new that is opening up, I will reach out to them and see if they want to be on the map, and then I will send them I'll send them the link actually to the SurveyMonkey questionnaire, which then comes back to me and I enter it in. That's how I do it. As I say, I've lost. I don't have an assistant. I'm one person, so I'm really trying to keep up with it and make sure that everything's fresh. One of the I guess the things I run into is when we look at medication-assisted treatment, keeping up with the Suboxone providers because they come and go. So really trying to keep up with them, and there may be stuff in there that is not correct. And if someone lets me know, I immediately change it. Third day is when I'll go around and I'll just pick out and I'll filter it out myself and go to make sure that some of the sites are still working. Did that
So
help
it sounds like there's a lot of reliance on others being able to provide you with information about what's new or if things have changed.
Yes.
Am I understanding that right?
Yes. Yeah.
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 Thank you.
Yeah.
It's a lot of work.
It is a lot of work, and I'd like to try to keep it updated. I'd like to add more to it. Most definitely. And I have a vision council, which are kind of my eyes and ears in different parts of the state.
Mm-hmm.
That they'll call and they'll say, "Hey, Darren, but usually I hear about something, but in case I don't, it could be anything. They may say this, sober living home is opening up, or there's a shelter that just opened up. Great, I'm going to reach out to them, and if they want their information in here, that's fine. I'll definitely put their information in.
So for those that are on the webinar now or who view it later, it sounds like it'd be really helpful if they do find some that a link's not working or that there's a resource that's missing, just to reach out to you directly to update the app.
Correct.
Great.
Yep. Correct. And I can, if there's anyone that knows of other resources, what I will do with Becca is I will send you the link for the site that for the Survey Monkey, if you want to send it out to folks, where they can forward it to anyone that they do know that may not be listed on here, that they can fill that out, and I will definitely I'll enter that information in.
Absolutely, I'd be happy to do that.
Yeah, I can do that. So it's.
Do others have questions? Is there a particular feature of this, Darren, that you think would be good to walk through? Or are there any that are a little bit more confusing, or what's your sense about that?
No, as far as looking at, when we're looking at my desktop right now, that's pretty good. When you want to filter it, that's pretty much self-explanatory. In order to filter it, you can go up to here, as you see, and you can show the whole list, which it'll bring in alphabetical order. So a person does not always have to click on something. They can look down through it, and whatever that they're looking, searching for on there. So that is helpful. I think one of the things regarding the app, what they'll find is that's fairly easy to use. However, if you go into the Find Help part of that, where we are dealing with either a tablet or a smartphone, is filtering that out also. So if you have an iPhone 6 and you open this up and you want to filter it out, you just have to go through a couple extra steps on that. And what you would do is, as it opens up the map, you are going to see the three little lines on the left-hand side, which is About and Filter, Go To, and it'll show the list. If you wanted to, you could hit Filter, and it's going to bring up basically everything that we're looking at on the desktop for check marks. So you can either check all if you want to see everything, or you could check emergency shelter, and you would check that, and then you would go right back to the map, and it would show you all the emergency shelters. So you can filter it out that way also. That's probably the only thing that's just the most challenging, if you can call it challenging, to work on the application that I have. Everything else is been fairly easy to work with. Try to make it very user friendly.
I think you've done a great job with that. This is the first app I've downloaded on my phone, and I've found it to be very, very user friendly.
Well, yeah, and I'm glad that you did. I'm definitely glad that you did, and I'm not trying to take. When I did this map, I wasn't trying to take anything away from anyone. However, I knew that it's specifically geared towards substance misuse and treatment for that. And as I said, I've added some extra things in there, to go with as far as food pantries. I got a list of food pantries. Public health, I put in some federally qualified health centers. A lot of times people, it's easy to filter it out and grab a hold of it instead of searching, doing a Google search and, searching for something that you may find. I just actually sent this. I had a call from Maine Pretrial in Bangor this morning that they were looking for some assistance. And I said, I can start blabbing off all this stuff. However, here's what I'm going to do is send you the map, and you'll be able to, find what you need, along with some recommendations, suggestions. But you'll be able to find what you need and encourage them to utilize it.
So for those who are on the webinar, do you have any feedback or any suggestions? I know this is probably the first time that you're clicking through it, but it seems like this could be a good opportunity for there to be some discussion about the resources that are in here. Just throwing that out there.
Yeah, and, any feedback that anybody has, if there's something that I encourage anyone, if they know of some other resources out there, to definitely provide them with my email, and as I said, I will provide you with the link to that survey and stuff. And it's probably not all. I'm going to say that it's not 100% correct probably right now. There may be a few that the websites no longer work. I just looked over those a couple weeks ago and fixed those. However, I try to keep up with it the best that I can and keep it updated. And I really hope that I don't have to take too many treatment agencies off in there. I'd rather add than take away.
Absolutely.
Yeah. All right.
Darren, so ready access to up-to-date information about services is obviously very valuable. So what do you see are some examples of different scenarios where people could use this?
One, I use it a lot is Suboxone providers. People are looking for medication-assisted treatment. A lot of people, they'll call, and I can always have this up and going, so I can say, where's your geographical area? Where you're calling from, and I can go right to there. That geographical area. I can look at that and give them numbers, immediately, which makes it easier. Or a treatment agency, whatever they may be looking for. Somebody says, I'm in the Somerset County area, then I can look and find them something. I can let them know if it's sliding fee, because a lot of people don't have insurance. So the information that many of them have provided me, which I asked for, is what type of payment do they accept. So being able to filter that out and direct people to something that is hopefully a good match for them that they can get into.
Great, thank you.
Thank you. Thank you for allowing me to show this.
Oh yeah, absolutely. This has been I think this app is a huge asset. I think it can be used in a lot of different domains, even from the examples you were just giving. So I think it is fantastic, and I'm grateful to you for taking the time to share it with us today. And so this is recorded, which means that I'll be posting it on MPHA's YouTube station, and I'll be calling it out in our next e-news and on our Facebook page. So we'll be sharing it as best we can, and then if those that are on the webinar want to share this as well, I think that'd be great.
I just saw a question come through.
Yes, I just saw that too. So why don't you answer that?
I couldn't read it quick enough. It doesn't stay on my.
No, I'll read it to you. Do you see a way that service providers could provide additional data or provide up-to-date information?
Oh yes, by all means, they could provide it by actually, once I give that link. That's how I look for that. If they're not on here already, as I say, once I provide that link to go to SurveyMonkey, it asked all of this information it's going to ask in there. So, description and stuff. So that's what I really depend on, is the service providers, if there are some out there, is to keep me updated, or if they're or give me new information, there may be newer information. There's been some service providers that have opened another office. So through the app, providers through the app, no, it's not available for service providers to update through the app. They would have to contact me directly, and I would do that. It would be. It would be a good app development if allowing that. What I found was, and I'll answer that is that I did allow that at first. However, what was happening is that by giving those permissions to do that, there was information that some folks were putting in there that was just not. It wasn't 100% accurate. So what it left me was going behind there and saying, okay, where did this information come from? And some people were getting a hold of the, looking at the map and saying, oh, I heard about this. I'm going to put it in there. And it just wasn't happening. And so I had to shut it down that way because I didn't want people hearing anecdotal information and then deciding, well, I'll put it on this map, and then having people, because I would be the one in the end that would receive the email or the call that says, hey, what do how did this get in there? This isn't true. So I'd love to have the providers be able to make any change, definitely make any changes to it. But in order to do that, I have to open it to everyone.
Yeah, that seems like you don't want people to input wrong information or to have, maybe by putting it in the hands of other, or having people be able to update it, there can be incorrect information at the same time. They're able to update it live and not have to kind of go that extra step. So that does seem like a challenge. I'm not aware of do you know, Darren, about other apps that are similar to this for other resources? I'm just curious how they update their information.
I am not sure. The only other app that is similar to this would be there's a friend of mine. He does the same job that I do in Maryland, and they've developed an app similar to this. And there again, they take care of. They have more people working for them, but they're the ones that keep it updated, and they do it themselves. With their, if I were to reach out to every service provider and say, I'll give you permission. I've got 606 places that I have to reach out to in order to give them permissions for this. We always hope that if people are going to put something in, it's your hope, if you leave it open, if someone wants to add to it, that they will put in correct information, as I've researched everything and put that information in. That doesn't happen all the time. However, it's not something that I could not try again, wouldn't be willing to try again, and because I'm notified if anything is put in. So I will take that and possibly roll that around today, and may open this back up for others that would like to to put something in. Yeah, and if it gets to be that that the information is just not true, I'll have to shut it down. However, all that I could use all the help. Would be great. Yeah. So yes, thank you for that question.
Are there any other questions?
Hello?
Mallory, I'm not
Hi.
on the webinar. I'm on the
Sorry. I'll let you get back to it.
Okay.
All right.
Okay, so I don't see any other questions. Is there anything else you want to say about the app?
No, I think everything, if nobody has any questions, was available. Did I still make it available? Some people had Amazon. What are those pads, the tablets that Amazon has?
Kindle?
Not sure. I did make it available for that too, because I had people like, hey, I've got a Kindle, could you do that? Yeah. So I went back and did that also. So I believe it's available for the Kindle.
That's great.
For anyone that may have those, but yeah, and if it updates, it'll automatically. If I do anything to it, and make any additions to the app itself, it'll automatically update. So it may it'll update when you open it again. It automatically does that.
That's great.
Yeah.
That's great.
Well, thank you.
Okay, well, not seeing any more questions. I will just let everyone know. So again, thank you, Darren, for taking the time to show us this, and amazing job creating this app. There is so much information here, and then hearing how you're updating it, it's very labor intensive, but I think it's a huge asset to a wide audience in Maine. So thank you very much.
Thank you.
If you do want to get in contact with Darren, his email address is dripley, R-I-P-L-E-Y, @masap.org. And I want to thank everyone again for taking the time to join us on this webinar. And I just want to let you know our next webinar will be on Valentine's Day, so on Tuesday, February 14th, also at noon. And it'll be led by Maine Responds, which is a statewide volunteer registry system that uses a secure database to register and verify professional credentials in the case of a natural disaster or a public health emergency. So that's also quite a robust resource to have. So if you're able to join, that would be great. You can register on our website, just like you did for this webinar. So thank you all again, and I hope to see you on another webinar soon. And Darren, thank you very much again.
Thank you so much, Becca, and thank you all for being on here. And I will follow up with an email with that survey link and some other stuff for you. Thank you.
That's
Have a great.
It's great. Thank you.
All right. Have a great day.
You too. You too. Thanks. Bye.
Bye.